So good day everyone, I'm Lymph Membreve and I'm going to report about the lymph nodes that should be inspected, the post-mortem activities of animals in slaughtering house. So the first is the mesenteric lymph nodes. So mesenteric lymph nodes are the key site for tolerance induction to food proteins and that they also act as a firewall to prevent live commensal intestinal bacteria from penetrating the systemic immune system. So as we can see in the figure 9, viewing and incision of the mesenteric lymph nodes. In this case, an incision was performed to demonstrate the mesenteric lymph nodes chains. So when we say incision, kaning gina-slice ang lymph nodes para makita kung na may problem o wala. So these are guidelines for inspection requirements. The inspection can be made more intensive or less intensive depending on the outcome of the examination. So magdepende ang inspect sa carcass body sa livestock kung ang outcome sa examination is grabe pod. So incise. These are some of the terminologies of the how to inspect the carcass body of the livestock. So incise. Incise means multiple incision or slicing. So, moto ilang gina-slice ang mga parts sa carcass body. Then, palpate, use above means to view or palpate. So, when we say palpate, moto siyang ginahilam, ginahawiran ang mga lymph nodes kung naay kaning problem. The heart of all cattle and calves over the age of 6 weeks should be inspected for cysticersus bovis, or also known as the tapeworm, either by making one or more incisions from base to apex, or by everting the heart and making shallow incisions that enable the cardiac valves and muscle tissue to be inspected. Incise if any lesions were observed in the submaxillary lymph node. So, ang submaxillary lymph node is kaning panga sa baboy or sa other nga mga livestock. So these are the criteria that should be inspected in individual livestock in slaughtering house. So number 1 is the cattle. In cattle, it will be required to correctly identify and demonstrate the head, organs, which is the heart, the cardiac tissue, liver, spleen, and lung if possible. The alimentary canal, genitalia, and carcass, including neck and kidney, individually for examination. So when we say alimentary canal, when we click the alimentary canal, this will be the alimentary of the cattle. Alimentary canal is the extending tube from the anterior part of the animal to the posterior part of the animal, which is the anus. So that is the alimentary canal of the cattle. The genitalia. When we click the genitalia word, this will be the genitalia of the cattle. This is the genitalia that should be also inspected in the postmortem activity. So, second is the sheep and goats. In sheep and goats, we have to examine the abdominal viscera or the external organs of the sheep and goats, the esophagus, the mesenteric lymph nodes. When we click the mesenteric lymph nodes, we can see this. This is the mesenteric lymph nodes of the sheep and goats. Also, the omental fat. The omental fat is this. This is the picture of the omental fat of the sheep and goat. And the spleen. So this is the spleen of the sheep and goat that should be also inspected during postmortem activity. Examine the bile duct and gallbladder and their contents. Examine and palpate their liver in the costal or ventral, costal or dorsal, and ventral surfaces of lungs. Palpate the bronchial and mediastinal lymph nodes, examine and palpate the heart. So, as I have said before, that the palpate is like touching the nodes, the parts of the livestock. Then, in pigs, we have to examine and palpate the mesenteric lymph nodes and the spleen. Palpate the portal lymph nodes. Examine the dorsal and ventral surfaces of the liver. Palpate the left and right bronchial and mediastinal lymph nodes. And also examine and palpate the dorsal and ventral surfaces of the lungs. When we say dorsal is the upper part of the lymph nodes, and the ventral is the lower part of the lymph nodes. And also we have to examine and palpate the heart of the pigs. So in carcass, we have to examine the carcasses including the musculature, exposed bones, joints, tendon sheets, and etc. to determine any signs of diseases or defect. Attention should be paid to bodily condition, efficiency of bleeding, color, condition of serous membranes such as pleura and peritoneum. So this is the picture of the pleura and peritoneum. This is the view. Cleanliness and presence of any unusual odors. So just like what we have observed in the slaughterhouse before, ilhang gi secure nga kani ang bodily condition sa livestock is kundi siya kaning healthy, and ilang gipang slice ang mga lymph nodes para nga ma-deliver sa market ang carcass body nga walay problem. In lymph nodes, so in figure 10, we can see this figure in the book. We have the superficial inguinal, internal and external iliac lymph nodes in a pig, viewed and palpated on routine postmortem examination. So this is the superficial inguinal of the pig, and the internal and external iliac lymph nodes. So this is the external and internal. 11. Medial view of the hindquarter. Superficial inguinal, internal and external iliac, and lumbar lymph nodes are palpated and incised in systematic or generalized disease. So this picture is already examined or inspected by the meat inspector. And figure 12, medial view of the forequarter with intercostal, suprasternal, presternal, and prepectoral lymph nodes. Presternal and prepectoral lymph nodes are incised, so na-slice na ang mga lymph nodes in this area. So this is the view of the superficial inguinal, external iliac, and internal iliac lymph nodes of the pig. Figure 13. Popliteal lymph nodes in a pig. So these nodes are incised if a systematic or general disease is suspected. So ang popliteal lymph nodes is kaning i-general yun siya examine para i-general yun siya examine kung naay disease nga makita sa examination sa pig. The example of the area of the popliteal lymph nodes of the livestock. Figure 14. The lateral view of the carcass, precrural and prescapular lymph nodes are incised in systematic or generalized disease. So, this picture is also already being incised or i-slice na siya para makita ang iyang mga generalized disease. In all animals in which systemic or generalized disease is suspected, in all animals positive to a diagnostic test for tuberculosis, in animals in which lesions subjective of tuberculosis are found at postmortem inspection. So this is the example of the tuberculosis that have been found in mesenteric lymph nodes of the animal. So this is the tuberculosis.